So hello everyone, thank you very much for logging on. My name's Catherine Jury. I'm a dermatologist in Glasgow with a role in other places in Scotland too. And I'm going to talk to start with about the EB service in Scotland, and
Hmm.
then we'll introduce you to our paediatric and adult nurse specialists. And then finally, we're going to hear from Erin, who helps support EB patients in Scotland from DEBRA. So just to give you a brief overview of what we're trying to do in Scotland, the first thing to think about is what sort of population we're serving here in Scotland, because how we organise ourselves and what we can offer is different from down south and places near the super centres. So just a little thought, the population of Scotland has come down actually, and it's currently sitting around 5.4 million. That's compared to England and Wales, which is sitting at 61, and Greater London actually sits at 9.1 million. So just when you're thinking about what's realistic to offer for our population, we have to remember that we're a small population and we do our best, but we're very lucky to have the super centres nearby that we can access as well. And in terms of the EB population in Scotland, these are figures that we collect on a regular basis and we have to submit to the Scottish Government on a monthly basis based on the people who are accessing our services. So we have in total about 68 children and just over 200 adults with EB diagnoses across Scotland. And the vast majority of our patients have got EB simplex. We've got a much smaller number of junctional patients, as you would expect, and then a mixture of recessive and dominant dystrophic EB patients as well. And patients with EB are seen all across Scotland. So although most of our population is based in the central belt, we've got EB patients as far away as Orkney. What you can see on this slide is to show you where the EB clinics are run in Scotland. So we have the largest number run in Scotland, where we run both adult, in Glasgow, where we run both adult and paediatric clinics. And then there are clinics also done especially for EB patients in Lothian, Tayside, and Grampian, and Inverness will also do EB clinics as well. But outside that, there are obviously dermatology units all across Scotland, and those are marked here with the red triangles, and EB patients are also seen in these clinics too, with links to the interested clinicians with EB. And the EB service in Scotland that we have is funded nationally by an organisation called National Services Scotland. And they're the people who provide the funding for our nurse sessions and for our administrative support. So currently our team is represented here. Unfortunately, Sharon and Pauline, who you'll see later, did not submit photographs, but Sharon was quite pleased to be represented by her dog. So we have myself offering sort of governance overview from a clinician's perspective. We have two paediatric nurses. We have Kirsty Walker, who you're going to hear from later, and Sharon Fisher, who many of you will know has been in post for a long time. We have business support from Susan Ewell, who's based at the Royal Infirmary in Glasgow, but supports work done across Scotland. And last year we were lucky enough to recruit Pauline Bates, who is our new adult nurse. Alongside that, we work with Erin from DEBRA, who has started coming along to our clinics, and that's been a real boon too. But there are lots of other clinicians involved in EB care in Scotland. Unlike the model that's done in England, where everyone tries to go to a super centre, we have more of a hub and spoke type approach. So there are clinics across Scotland run by a variety of different dermatologists that you can see here. So we have Professor Brown in Lothian, Dr. Hearn in Tayside, Dr. Ray in Grampian, and Dr. McFarlane in Highland. And all of us, whether we're based in Glasgow or other places in the country, will then liaise with our local specialists, be it dietitians or podiatrists, gastroenterologists or geneticists, to try and provide local support as best we can for the patients that we're seeing. One of the key things that we try and do is help support people with their diagnosis. And when you're thinking about getting a diagnosis of EB, it's based on two things. Something we call the phenotype, which is how your skin condition presents. What problems do you have as a consequence of your skin condition? And does that fit with the description of EB? And then if we're trying to be a bit more precise, we'll try and get genetic testing done to see if we can identify precisely the underlying genetic cause for the symptoms that trouble you. We're not always successful in identifying a genetic mutation. We probably managed in about 80% of people, and that's the same across the world. Technology is moving on and our understanding changes all the time, but please don't feel that if you don't have a gene identified, you don't have the diagnosis. It's all based on what you present with, and eventually the technology will catch up with us. So as I've said, it's not necessary to know the gene responsible for your disease for you to have a confirmed diagnosis of EB. But if we can identify the gene, that might be important when future treatments become available, specifically targeting the genetic changes, and it has an impact on pregnancy as well. And we very much try and ensure that genetic testing is offered when it's appropriate and feed the results back to you when we get them. When things get really complicated for our patients in Scotland, we are very lucky to be able to tap into the specialist centres. And often we find the easiest one to get people to are the centres in London. So for children, that would be Great Ormond Street or St Thomas's Hospital for the adults. These are fantastic centres with a huge wealth of experience, and we know that our patients are well looked after and safe when they're treated there. Sometimes we get asked about why certain tests and certain investigations can't be performed in Scotland, and that really relates to the amount of expertise you can build. It's very difficult to be an expert at stretching EB esophagus if you've only got 2 people who need it doing. So we're very, very lucky to be able to rely on the support for our colleagues down south, and they always step up and help when required. So how do you get the best out of what we can offer here in Scotland? Well, we want to be open and we want you to feel that you can contact us whenever you're concerned. Don't wait for an appointment. If you've got an appointment to come and see us in 3 months' time, but you're worried now, get in touch because that's what we're here for. We're here to help. We might not know all the answers, but we will always try our best to find someone who can help, whether it's locally or down south. But to help make our job easier in that regard, you do get in touch. So if you are going to move house, changing your phone number or your email address, do let us know so we can keep our databases up to date. So if there are changes that we need to inform you of, we can do that as easily as possible. And please, for appointments for clinics, these are small in number. And if you can't make an appointment, do let us know so we can make the best of the resource that we have. The other thing that we're often asked to support people with is when they have to go and see other healthcare services or professionals. I think I've been working with EB patients for over 15 years now, and often this is an area which causes a lot of anxiety. So what I would say is always be prepared when you're going to see someone new with a new problem. Be prepared and expect that they're not going to know what EB is, and don't be afraid to take information about your condition with you. And I'll often ask people to take the relevant DEBRA information sheets about their diagnosis. If you're worried or you think you're going to run into problems, then get in touch with the nursing team and we can help support either in advance of your appointment. We've had people going to appointments with EB patients just to make sure that everyone's on the same page and everyone understands the particular challenges. If you need an operation or you're having a baby, whatever it might be, get in touch with us. And this is our generic email address and we'll try our best to help. And it's also helpful if you can let people know which dermatologist it is that helps with your skin, because again, it's a very small world in Scotland. Medicine in Scotland is small. We largely know each other, and it may well be that your gastroenterologist knows your dermatologist, and it makes things much easier in terms of transfer of information. So as I've said already, assume that anyone new that you've not met doesn't really know very much about EB. And remember, you are the expert in the condition that your skin presents with. You know more about it than anyone else, and your voice is really important, sharing that experience and knowledge. Consider taking someone with you to an appointment, friend or family member, or if you want one of us to come, if we can, we'll try and help you do that. If you're going into hospital for something, whether it's a cataract or a hernia or a new knee, it's really important to take dressings and adhesive remover with you so that you're prepared. Wards are often not very well set up for these types of things. So if you can take things with you, it really helps make things much easier. And also do let us know if you're being admitted. Obviously, you can't do that if it's an emergency, but if it's a planned procedure, let us know and we can liaise and support with the teams involved. Our role is often to help other teams feel confident because people start to read a bit about EB and their immediate reaction is often, oh dear, I really don't want to do that. Whereas with the right support, we can often have people undergo procedures locally in a very straightforward way and everyone's happy at the end. So that's all I wanted to say to give you a little bit of an overview of what we have available, and I'll leave you with our email address here. I was going to pass over now to Kirsty, who's one of our paediatric EB nurses, and she's going to talk a little bit about her role in the service. Thank you.
Thank you, Catherine. Hi there, my name's Kirsty Walker. I'm one of the nurse specialists and I work alongside Sharon Fisher. I'm quite fairly new in the role, so nice to see you all. I'm going to start by explaining a little bit about my role as an EB nurse specialist. So I'll just share my screen with you. Thank you. Share. So helping families and children with EB in a remote setting in Scotland. Okay, so my role. As an paediatric EB nurse specialist, it's important that we work in partnership with families and other services to support health and well-being of children living with a diagnosis of EB, especially in the remote areas in Scotland. Care and support can be delivered to best suit children and their families living in a remote area. The EB nurse service is based, as Catherine says, in the Greater Glasgow and Clyde NHS. However, the nursing service will provide care for patients across Scotland and can support clinics run by local clinicians in Glasgow, Lothian, Tayside, Grampian and the Highlands. The nursing service is currently offering support in 12 clinician-led clinics throughout the year. And as Catherine mentioned, there is over 60 children living in Scotland with EB, the majority of them having EB simplex and others with a diagnosis of dystrophic EB. Liaising with all known professionals from health, education and the social sector will only subsequently promote the child's health and well-being while supporting their parents and carers. Information sharing with obstetricians, midwives, health visitors is helpful prior to the birth of a new baby with a known family genetic pathogen. Thereafter, if genetic testing confirms an EB diagnosis, support and advice will be provided as needed until the child is transitioned over to the adult service. So caring for a new baby. Prior to a baby being born in a remote area in Scotland with a suspected EB diagnosis, the paediatric and adult EB nursing service will liaise and share information to ensure families are feeling well supported and clinicians are well informed. Initially, the nursing service will introduce their role to families and share with clinicians guidelines for caring for a neonate with EB. The nursing team encourages families to reach out with any questions or advice needed before the birth of their baby. Most of this contact is conveyed by emails, telephone calls, or virtual meetings. The EB nursing team aim to support in a timely manner with a hospital visit or a home visit for any new baby that's showing skin fragility. The nursing service can demonstrate skincare and or dressing changes virtually or face-to-face until families and health professionals are feeling confident with what is being shown. Following a new diagnosis, the paediatric nursing team will submit a referral to their local dermatologist and prescribe an adequate amount of dressings, treatments to support the child's skincare needs. To ensure children have a good supply of dressings, the EB nursing team can introduce families to a healthcare supplier who can offer home deliveries, and this is particularly helpful for families living in remote areas. For when children are starting school and nursery, this can be a very daunting time for families. The EB nursing team can educate the nursery and school teachers before the child starts school by sharing an understanding of the child's diagnosis. With parents' involvement, a care plan can be put in place for when the child is in attendance in school and nursery. Additionally, nurses can also demonstrate to teachers the safe way to burst blisters and to apply dressings. This will help relieve any discomfort or pain experienced by the child. Before the child starts school nursery, other equipment may be necessary to ensure all health needs are being met and the child is being looked after in a safe environment to ensure their skin care. The nursing service can engage with social services to request support for funding for appropriate equipment, and on occasion, a referral may be submitted to the occupational therapist requesting further assessment of the new environment. It is important that families living in remote areas have available access to all appropriate professionals, and this is something that the nursing team can help by coordinating regular multidisciplinary meetings. So, additional support for children. A diagnosis of EB can have a significant impact on a child's mental health. The outcome from a clinical assessment may propose a referral to a clinical psychologist. However, the nursing team can also signpost families and children to available charities that are out there to support. Nowadays, children and adolescents feel more comfortable with engaging with their peers through social media and online, and this type of support for children living in remote areas can be very beneficial with improving their well-being. To help children living with EB feel included, the nursing team have in the past applied to charities that can help a child build their resilience, confidence and independence. The EB nursing team ensures that children and families, particularly in the remote areas of Scotland, are made aware of all available resources. The paediatric nursing team can offer virtual or face-to-face consultations to families in remote areas. Planned home visits within Scotland can be scheduled to deliver skincare as requested. Information sharing and good communication with clinician adheres to our nursing code to ensure patient safety and effective care is being delivered. However, as well as good communication with our colleagues, it is vital to communicate clearly with children and their families for a trusting relationship to develop. Forming good relationships with our families in remote areas will help them feel less isolated in challenging and difficult times. Our contact details are shared with families to offer our support to help them with any worries or anxieties experienced, and our contact details can be found on the DEBRA website. Thank you for listening.
Thanks very much for that, Kirsty. That was great.
Yeah.
I'm going to hand over now to Pauline, who is our adult nurse specialist. So I'm just going to put her slides up. Okay. Oh. Try that again. Doing that. Right, it's been going so well. Right, try again. So we should be. Can you see our slides? Yeah. You can. Great. Okay. I will pass over to Pauline, who's going to move in front of the camera.
Shuffle. So I'm going from here, yeah.
Yeah, go through that. Yeah.
Hi there. So just to follow on from Dr. Judy and Kirsty, I'm Pauline. I'm the adult EB nurse in Scotland. And as we've discussed, Scotland's population covers a vast area of land, so we have to be quite flexible in our care. Go on to the next slide, sorry. So we do offer clinics in Edinburgh, Glasgow, Inverness, Aberdeen, Dundee, but these still cause quite a lot of travelling for many of our patients. Often we opt for remote care. Remote care means you can get your care local to you. You don't have to travel to us. So that would be the benefits of it. It also means you have access to specialist EB services. You can carry out your care at home independently with regular contact from the EB team. And it also works alongside face-to-face care. Our aim is always patient-centred care. So the EB team, GPs, community care and healthcare professionals all have to work together to achieve this. Perhaps it's easier to consider a scenario that you might be familiar with to see how this works. So imagine you as a patient are concerned with an area of your skin. You would hopefully contact me because you've got my number to hand. I would discuss your problem. You could let me know what's been happening with your skin, what you're concerned about, what dressings you're using and how your general health is. And hopefully you would send me a picture too. After this initial consultation, we could decide that maybe a change of dressing and an addition of a lotion might be needed to help the situation. I can simply send a request to your GP, they can send a prescription to your local pharmacy and you can pick it up and start your treatment straight away. Equally, we might be concerned about the area of skin. We might decide that a wee bit more input is needed. So I'd ask you to attend your GP to get a swab taken. I'd contact your GP to let them know you're coming and let them know our concerns. I'd also let your EB consultant know what's been happening with you. The results of the swab go back to your GP and they can then start you on any relevant antibiotics and hopefully things clear up. And you and I would keep in contact till the situation is cleared. This can also be helpful if you're having difficulty with dressings. Perhaps there's a particular area you can't get your dressing on. Perhaps we've discussed it on the phone and I've even come and given you a visit, but it just needs an extra pair of hands. So in this instance, I can get in contact with district nurses or practice nurse and they can do your dressing for you, either at home or in your local GPs. As well as offering you care help, we can also help other professionals that come in contact with you. For instance, you might have a dentist that's not familiar with EB. We can help and support them and even connect them with professionals in their field. These are the services that we can offer. Telephone appointments, it's not really an appointment, you can just phone up at any time. Virtual or video appointments can be helpful. I attended the Aberdeen clinic virtually the other week because there was a storm and I couldn't get there, so that was good. Home visits, I'm always happy to come and visit you at home if that's appropriate. Workplace education, you might be having problems in your workplace. It could be just you need help with a uniform that's uncomfortable or your desk is situated near a radiator. Sometimes a letter of support can help with these things. We can help refer you to local other healthcare professionals in your area, podiatrists or midwives. Prescription requests, we can send a request straight to your GP for any of your needs. It could be for dressing changes, etc. Escalation device, maybe you're concerned about an area but you're not sure whether you should seek advice. We can help you with that if you get in contact with us. Dressing advice, we're always there to help with that. And face-to-face consultations, just because you're getting seen remotely doesn't mean you're not seen face-to-face as well. We still do in person. So this is maybe the most important slide. This is just all our contact details. So I hope you find that helpful. Thank you.
Great. Thank you. Yeah. Thank you, Pauline. Okay, and we thought we'd sort of take questions at the end if there are anything specific. Sorry? Yeah, going to pass on to Erin now. Yeah. So Erin's our invaluable support from DEBRA. Most of you will know her already, and she's going to give you a little overview about what she can offer as well.
Hello, everyone. Let me see if I can get my slides. Can we see my slides? Yeah, fantastic. Great. So I'm going to talk quickly about some common support needs that we have that we see for members who can't access the specialist centres and how the community support team can help. Obviously that is majority in Scotland because that is my main area, but hopefully some of this advice could transfer to people who are just a bit more remote from the specialist centres in other parts of the UK as well. So one of the first things that I get a lot of is accessing clinical support. So a lot of times I'll get inquiries from people who have maybe not seen their specialist for a long time, not seen the nurses for a long time, and they want to figure out how to get back into it. So a couple of quick points. If you continue to attend your regular EB clinic, so that's usually 6 monthly, yearly checks, then you remain on the clinic list. If you keep in touch with your nurses, you'll remain on the clinic list. But if you've lost touch with the EB team over the years, if it's been, 5 years, 10 years since you've been seen, which I know for a lot of people in more remote areas, they do just figure out ways to get on with it without needing to go to the hassle of coming to a clinic. They do fall off the clinic list, and when that happens, we do need to get you re-referred. So what I would advise that you do if you have been dropped off the clinic list, or if somebody you know has and they have looking for some advice, is to get in touch. At least in Scotland, we have to refer back through the GP, but we can provide a supporting letter that was carefully curated by myself and Catherine, who made sure that all the instructions were very specific to Scotland, at least. And I know that my colleagues in South, they can also help with people who need to be referred back in, but that process is different, obviously, different NHS boards. We can provide supporting letters, and that will explain the referral process and the benefits of specialist care, because there are a lot of benefits to specialist care, which I will go into, and obviously the ladies have already gone into. So for clinical and non-clinical essentials is another thing that we see often that people need support with. So for prescriptions, again, I know the ladies have already said, for some people their local services work really well. They have really great GPs, they have great pharmacies, they have, even with a bit of EB support from the nurses, they can get the majority of the supplies that they need. Their GP might take a bit of an interest in their condition and learn more about it, but we know that across the board that's not always the case. So in that instance, we do obviously recommend that we look into Billings. Billings is a online remote prescription service that if you're a DEBRA member, you get some free exclusive perks. So they would call you every month for a check-in of what your stocks are like and how you are. They can, do all your dressings, your needles, everything that you might need. And the nurses are also glad to liaise with Billings, especially in more remote areas. This is really beneficial. If you're struggling to get certain things, or if you're struggling with understanding with your pharmacy or GP understanding your condition, then that is something that's really beneficial to look into. Obviously, in the first instance, we would recommend that you get the EB nurses involved with your local GP and pharmacy, because sometimes that little bit of education and a little bit of support from them is just all you need to get going. And we also do, on the other side of things, the non-clinical essentials. Things like cooling items, seamless clothing, fans, the things that we know are critical to survive an EB, especially in the warmer months or, in certain situations. Please do come to us. Always seek out your community support manager if there's something that you feel like would benefit you and that would improve your experience of EB. We're always happy to see what we can do. A lot of times we can do support grants towards this to cover the cost. So always reach out to us. We're always happy to help. If we don't know the answer, we'll always try and find it. So another common problem that we have with people that live far away from their EB centres is transport to appointments and how to manage that both practically and financially. So on the one side, you have NHS Travel Scheme, which is available to those that are eligible, that come under income support, so are on benefits like universal credit or apply for the NHS low income scheme. They can go to their appointment if they bring proof of eligibility and the receipts for their transport or receipts for mileage. They can be given some reimbursement from the cash office of the hospital they're attending. If that's the case, and if you are eligible, I would ask, your nurse, your clinician, whoever it is you're seeing, they'll be able to direct you to the cash office. You just need to make sure you're coming prepared for that. On the other side of that, I know that does not cover everybody. Not everybody's under that eligibility. We can, in some cases, award support grants to go towards travel costs, especially if you're travelling quite far for your appointments. If you are one of the people that has to travel to the super centres down south, we can support with costs that are associated with going to those appointments. Again, hotel costs for extensive travel, for specific situations. Always get in touch, because again, we're always happy to help if we can, and if we can't, then we'll find a way to do it. You can also liaise with the staff at the super centre that you might be going to. They can often arrange things like transport and hotels. But yeah. Next is peer support. Peer support is one of my biggest passions when it comes to the EB community, is trying to get people in touch with each other. I think it's invaluable. I think that a lot of the people that I've worked with over the years have really benefited from getting to know others in the EB community and to learn that kind of peer-to-peer knowledge, which is really invaluable. And especially in isolated local communities, that can be so crucial. If you've never met another person with EB, or you've never been able to find someone that you relate to, or to someone that understands your skin, well, you'll know how key that is. Peer-to-peer knowledge sharing can be so beneficial, obviously alongside your clinical support, but for those little bits and pieces that you don't think about day to day, that you might not feel like you need to necessarily talk to the nurses about, having someone that you could get in touch with that has gone through something similar, or another mother of an EB child, is always beneficial. And also something to bear in mind is that there's always new members to the community who need the guidance and reassurance, and your experiences can be helpful. Every life stage and experience brings new challenges with EB. So even if you are someone who is extremely experienced and has been living with EB your whole life and feels like you've got everything, got all the information and everything down, you never know when something new is going to happen. You never know when something's going to change in your life, and you're going to have a whole new experience of something to deal with. So always reach out again. I'm like a broken record. Reach out to community support or your nurses, because we're always happy to try and put you in touch with somebody, whether that's again a clinician, or whether that's peer support of somebody who either lives local to you or has a very similar experience to you, whether or not that you feel like you're super experienced, or whether you feel like you need the support of somebody who's experienced. We can try and get you together. And then accessing community, similar to peer support, but in a more broad sense. So in person, those options would be attend your clinics. I feel like we're all broken records with this one. Attend your clinics, whether that's yearly, 6 monthly. I would really strongly advise that you go to your clinics. I know it can be a bit of a faff, especially when you feel like your skin hasn't changed much, or you feel like your routines are really solid, and that you feel like you have everything sorted. You never know from one day to the next if something's going to happen where you feel like you need that support. And if you drop off the clinic list, then we have to go through the referral process all over again. So if you remain on the clinic list, attend your clinics, you can text, call the nurses, the clinicians anytime. As Pauline went through the process of getting in touch with her and how that would look, that is all at your fingertips if you remain on clinic list and you continue to attend your clinics. The resources that you can get there are invaluable. They have great relationships with us at DEBRA. They have great relationships with the community as a whole, of all the services across Scotland, and in our case. So they are really an invaluable resource, even if you think that you don't need them. And also attend your local DEBRA events. So, check in with CST about your local DEBRA events. We're always looking to try and bring those to the more rural communities, the more isolated communities. So check in with the website, check in with your local CST, especially if you're in a more isolated area, because we especially want people that are isolated to come to these events to be able to engage with the community. So if things like cost are something that's a barrier to you, then please do get in touch, because we do want to help with that. If that's the way that's going to get you involved in the EB community, we are there to help with that. And then again, if you're living rurally or remotely, virtual community is really important. I know Kirsty had spoke on that as well. So attend your webinars. Thank you all for coming. That was really great to see so many of you here. Share your experiences. So whether that's, just with people that you know personally, on any kind of forums or groups, but also we have an engagement team at Member Services who are really keen to get stories out there of different people living with EB, their experiences, how they coped with certain challenges in life, or things that have worked really well. So again, broken record, get in touch with your community support manager, or get in touch with the Member Services team if you feel like you have an experience that would benefit people, because we're always looking to share those and to give inspiration and hope to the community. Obviously reach out to CST, I don't need to say that again. And social media, EB Connect, are the kind of main places that I would say to go if you're, again, feeling isolated, looking for community. If you're maybe not at the stage where you want to reach out for specific peer support, there are some good Facebook groups and EB Connect out there. EB Connect is a specific forum for people with EB. You can find the link to that on our website. And yeah, that's really the main challenges that I see day to day with community support. And this is my well, not my information, the information for community support team in general. So that will apply to anybody across the UK. If you get there and you're looking for me, they will send you my way, so don't worry. But yeah, please do get in touch. If there's anything, I said, if there's anything we can help you with, we will happily help, and if we don't know, we will find out.